how to use HCG, okay, human chorionic gonadotropin. And in this video I will talk about when you should use HCG, and I will show you also better ways as always, okay? So HCG is a hormone used in medical treatment for certain conditions, okay, including hypogonadism, but its effectiveness and application depends on type of hypogonadism, okay? So what is HCG, what HCG is doing, okay? So HCG is a hormone that mimics luteinizing hormone, okay, which is crucial for stimulating the testes to produce testosterone and sperm, okay? So for primary hypogonadism, okay, when testes themselves are unable to produce adequate testosterone or sperm are not good, okay? So I think HCG should be used only in the case of secondary hypogonadism, okay? The problem lies in the brain, hypothalamus or pituitary gland failing to signal the testes to produce testosterone and sperm, okay? So HCG role in secondary hypogonadism. HCG is very effective in treating secondary hypogonadism because it acts as a substitute for LH, okay? So directly stimulating the testes to produce testosterone and support fertility, okay? HCG is also used in other conditions like in PSSD syndrome, okay, in PFS, okay? So also guys on TRT are using HCG to maintain fertility, okay? So guys, HCG is also suppressive, okay? So also higher doses can also have negative effect on Leydig cells, okay? And also you can create antibodies to HCG, okay? So let me talk about how you should dose it, okay? So you have two ways how to dose it, okay? So also HCG must be given by injection, okay? Subcutaneous way to inject HCG, okay? So the best would be like give yourself 2 to 3 doses per week, and you can start with low dose HCG and high dose HCG, okay? So high dose, generally in some men, HCG can really spike estradiol like crazy, okay? So if you want to have, if you, for example, if you are on TRT, or if you want to also keep great erection, okay, guys, you don't need to forget that you need to keep your estradiol under 35, okay, because otherwise you will have a problem, okay? So if you start with HCG, okay, so after 10 days finding the sweet spot where your, for example, testosterone is like 800 and more, look at your estradiol and other things, okay? Because if your estradiol is 40, 60, 70, I have seen even much crazier values, okay? So then you will have, for example, for sexual functioning, you will see no effect, okay? So for example, PFS guys, PSSD guys, okay, when the estradiol is through the roof, of course, there will be problem with erections, okay? So, and then you need to use Cialis and so on. What's the reason for this, okay? So, I personally think it's really great to find the sweet spots for you, okay? So, there are like recommendation, low dose is like 500 I use 3 times per week. Maybe you can start with like 800 per week, or like 600 per week, and to see where you add with testosterone, estradiol, and so on. One great tip, guys: vitamin E will support the effectiveness of HCG. I see a lot that because antioxidant will always support our testes. I take antioxidants every single day, and my testosterone, even without things like HCG, TRT, and so on, is high. Okay, so but I do also other things, okay, to support my natural testosterone production. Okay, but for you on HCG, try to add, for example, vitamin E and see what will happen. Most of guys see really increase in testosterone from the same dose. Okay, so test it and you will see. Okay, so high dose is referred as 1000 to 4000 IUs 3 times per week. From my point of view, it will skyrocket your estradiol and you will really use anastrozole or something like that to manage your estradiol. You really need to be careful because you don't want to crash your estradiol, but you will probably take AIs every single day, because I have some really crazy numbers like 100, 150 estradiol, and it's no fun. Okay, so I prefer low dose HCG. Okay, so 2 to 3 times per week. Okay, and I want to also give you one tip. Okay, secondary hypogonadism. Okay, it's a problem. It's a problem that your hypothalamus or pituitary gland cannot produce more testosterone or GnRH, okay, gonadotropin release hormones, okay. In case of secondary hypogonadism, I made video today, okay, that lowering prolactin and estradiol, okay, alone can reverse this condition. Okay, I see it in many guys because, for example, guys taking several medication, okay, not only SSRIs and even some antihypertensive and so on. There are several medications that can really spike up your prolactin, okay, and so on, and it will block your gonads, guys. So you can either start with HCG, this whole complicated process, injections and all that kind of things, or you can focus on lowering prolactin, and sometimes combination of lowering prolactin and keeping estradiol in certain ranges will do the best thing, okay? And you don't need injection. HCG is expensive, you don't need injection, you just really need to lower the prolactin even as far as 4, okay, nanogram per milliliter, okay, estradiol from like 20 to 25, and you will be able to reset, okay, your hypogonadism, okay, and your gonads will start to work, okay. So if you need my help, reach out to me for a coaching and give a like to this video, okay. Bye.